Hello, everyone. Thank you very much for joining us. My name is Matt Callison, and with me is Dr. Brian Lau. We're with the Sports Medicine Acupuncture Certification Program. We're lucky enough to be able to have this sports podcast with the American Acupuncture Council, so we want to give a big shout out to the American Acupuncture Council. Thank you very much. We have a great opportunity today that we can invite a number of top speakers in the sports acupuncture field. And today we have Dr. Michael Corradino. He's the creator and founder of Neuropuncture. It's the only complete neuroscience acupuncture system that we have here in the United States. He's been clinically practicing acupuncture for 25 years, has been traveling the world teaching a system and researching neuroscience acupuncture for the past 15 years. He's been involved in groundbreaking electrical acupuncture research and is a published author in this field. And from what we understand, he's actually working on his third book. Michael, welcome. Thank you so much for joining us. Really appreciate it.
Yeah, welcome, Michael.
Thank you guys so much. This is a real incredible honor. Thank you.
Well, should we just jump right into the first topic?
Sure.
All right.
Sure.
So what we discussed was let's get into a conversation about neurophysiological mechanism of acupuncture. Why don't you go ahead and take it, Michael?
All right. So I think on this particular topic, I think it's important to kind of plant a little flag right here of acknowledging that the language of our medicine, being from 2,500 years ago, was our ancient predecessors and founders of our medicine observing physiological phenomena and putting it in the language and terms that they had at that date, and that the unfortunate, I believe, the very strong unfortunate mistranslations of energy and meridians, and I know that a lot of our professions like to use that, was really mistranslated by by Soleil de Morant, who was not a physician. I think that's very clear to make that point, because in my travels to China, there's strong documentation of physicians from Germany, America, and France that traveled to China in the 1600s. And the physicians, when they looked at the classics, understanding anatomy, physiology, pathology, clearly really, translated Jinglo and Mai and Qi more as breath as Qi, and pathways and channels and networks, and actually points they translate as neurovascular nodes. So when you put the physician hat on as a physician, I think that the neurophysiology understanding of acupuncture was kind of side routed because of the energetic model. But today, using 20th and 21st century medical sciences, we can absolutely understand the physiology of acupuncture. I think a lot of the groundbreaking research with functional MRIs clearly denotes that we are modulating the nervous system. We can target specific regions of the brain, specific receptors with electrical frequencies and different hand techniques, which is measured by frequencies. And we transmit signals along the neural pathways that then communicate with the entire body, because, brain being the CPU. I teach 5 main neurophysiological mechanisms, and I think they really clearly do explain all of acupuncture's clinical phenomena today.
Awesome. All right, well said. Brian, do you have anything to add?
Yeah, well, in the work we do in sports medicine acupuncture, I think, Michael, you probably look much more from the neurological aspect than we do, though, of course, we do take a lot of consideration of the neurology, Jia points, and we'll get into those in a little bit. Of course, motor points, we'll get into those in a little bit. But one of the influences of mine in the last several years, and I think, speak for Matt, maybe he'll agree with this, is some of the work from the physio from Italy, Luigi Stecco. And he has a very fascial, kind of myofascial mechanism, but also, his work is called myofascial techniques or something like that, myofascial therapy. But he initial terminology they used was neuromyofascial, because, he's looking at how the fascia communicates mechanical pull, and helps through that mechanical pull helps inform proprioceptors in that area. That it's really a mechanical stimulation that informs those proprioceptors, and then that helps in terms of coordinated movement, helps certain muscle groups work together to be able to fire, and then the antagonist to be able to relax. And there's a communication network that to some degree is the brain, but it's really also, his view is a little bit of the mechanical communication that is really driving that stimulation. It's a little bit more of the fascial aspect. I think you're a little bit more in the neurology aspect. I don't know if the two necessarily are exclusive, but
No.
it's an interesting perspective.
Yeah, that's a good point. And as we know, it's that there's no real segregation with the human body, right? I mean, it's all interconnected. So with the nerves, I think we can probably say that those nerves are a big part of the channels, but that's not the only part of the channels, right? So
Sure.
with the neural stimulation, that is going to be affecting every cell in the body, no matter where you end up putting the points. There's always going to end up being a change. So that's the fantastic thing about neurophysiological aspect. So, I mean, adding the different frequencies and the different waves onto the needle itself is going to be obtaining a number of different rewards or penalties sometimes.
Exactly.
Unfortunately, you can still treat the excess and the deficiencies using electric stimulation. And so it's fantastic. I love this topic. It's a good one. Michael, back to you.
I would like to definitely add, like what Brian was saying, I don't think they're not connected, as Matt just clearly stated, the fascial nervous system, because there's been some real strong research that, supports the fascia being implicated with acupuncture, but the fascia wouldn't be able to transmit some of their signals without neural innervation. So I think there is an absolute, connection there, and that, again, in my research, I think that the neurophysiology really powerfully empowers the practitioner when they understand that.
Yeah, absolutely. On all levels, right? Your primary channel, your continue channels, your luo channels, it's all being affected.
Absolutely.
This is good. This is actually a good segue into points, unless Brian, that you wanted something to add.
That's exactly. I was curious about, when you're through your perspective and your work, when you're needling points, especially, in acupuncture, we have a lot of primacy of the transporting points and chi clef and low connecting points and the points below the elbow and below the knee. When you're working with those points, are you then thinking of what nerves being stimulated? Is that sort of your first sort of go-to in terms of the effect you're trying to achieve?
100%, Brian. That's exactly it. And the classics actually state that, right? That the chi and the pathways get closer to the surface from the elbows and those joints below, and that shows actually that we have more clear access to those nerves. We can use an example using low and source points like lung 7 Li4, both on the radial nerve, right? Bladder 58 and kidney 3. You got the tibial and surreal bifurcations of the sciatic and peroneal nerve. So I think they do lie, and they do definitely communicate, and they modulate each other. When we're looking at points, again, I look at, neurovascular nodes. The NIH came out with this wonderful study where they used an invisible marker, and they had, I think about like 10 practitioners mark and locate a point and then needle it and then stimulate it and took a functional MRI of it. And what they found out was that none of the practitioners found the point the same way or the same location. So it's not a point, right? It's more of a unit or a region, but there is differences from on the same nerve, different regions, right? And that's been confirmed as well, like pericardium 6 or pericardium 5. They actually have different regions and effects on the brain. So it could be the same nerve, but they are locations, but they're not points.
Yeah, I gotcha. That's I have a been very curious about that. Is there something unique about the various, stream points or Jing River points? Is there something unique about those points neurologically? Like, do some of them tend to correlate with branches, where the nerve branches, or is it really just point by point? Obviously, there's something unique in terms of how they affect physiology, but is there something anatomically that you've observed that's unique about them?
Li4 to lung 7 has that. Oh, I'm sorry for interrupting. Was that a question, Michael? I'm sorry. Go ahead, buddy.
No, it's just for whoever.
Yeah, no, Matt, I think you'll be able to probably answer this better. You both can do this, but check this out. Okay, so we know that Dachi sensations has about 8 main classical sensations. You guys are all familiar with spinal anatomy. We have the spinal thalamic tract, right? And there's 3 of them: the anterior, posterior, and lateral. There's also the spinal cerebellar tract that brings up transmissions from the exterior. And how can we affect those spinal cerebellar tracts for balance and proprioception? Is through the points on the wrist, or the river points. because those tend to actually target more the spinal cerebellar tracts. So Brian, to your answer, I think, yes, there can be these points that do maybe affect certain spinal tracts different than other ones. And that's based on the receptors you're stimulating and where they're located.
Yeah, that's really interesting. Brian, I think what I understood you say, Brian, is there actual physical conduit going from one nerve to the next? Like, for example, she cleft, no, I'm sorry, like a source and luo combination. Is that what you're talking about, Brian?
No, I guess I was thinking, I'll use Jing well points. I would assume Jing well points being where they are, that they're at the termination of various cutaneous nerves. And that would seem like a pretty consistent. Now, how that affects in terms of communication back into the central nervous system is kind of what Michael was speaking at. But I guess what I'm wondering is if the Jing well points are a termination of certain cutaneous nerve pathways. Are other nerves, do you tend to see a correlation that there may be at a bifurcation of the nerve, or is that really more of a point by point?
Well, I do know that perfect example again, right? Using the low end source of large intestine 4 and lung 7, that's great for upper respiratory things. We know that's the radial nerve. It goes into the brachial plexus. The cervical 8 nerve is part of the brachial plexus, and that's Ding Chuan. Those nerves do affect the lungs. So we do see, I think, those correlations, just like bladder 58, kidney 3, cerebral tibial or peroneal tibial running up into the low back, helping out with low back pain, and then any visceral muscular reflexes, which I'm sure we'll go over at the Huato Jiaji points.
Sure.
So I see some correlations to that.
Cool. Right.
We have a video on our YouTube.
I was thinking of that.
Yeah, we've got a video on our YouTube channel that shows the interdigital nerve that branches off of the radial nerve and goes right in toward LI4. So
Nice.
we saw that. Yeah, it's so much fun. We saw that. So we saw that connection. But then in our cadaver dissections, we looked at other source and low anatomical areas to see if there was a branch like that. And we couldn't quite find it. And this is where we hypothesized that it's probably more of a going from nerve to then fascial plane that connects to that point. And then you have that mechanical aspect. Yeah, I don't know, but it's just kids. We're just loving what we're doing, so we'll check out the next cadaver and see what we can find.
Absolutely. I mean, when I was there for your cadaver, I'll bring it up when we get to the motor points, but you guys just do phenomenal cadaver work and dissection work, and I'm really impressed, man. We'll talk about it. Well, we'll talk about it when we get to the other stuff, definitely.
Thank you, Michael. It was a real pleasure to hang out with you as well. That's for sure.
Thank you.
Should we get into the motor points?
Sure.
All right. Okay.
Sure.
Well, something that I've been researching for a long time is the neurophysiological location of the motor point located on the skin, and then going deeper to see where that motor entry point actually is. So there's different names for the motor point. Some people call it a neuromuscular junction, which can be a motor point. That is, from what I know of, as being an internal motor point. The research that I've been working on would be where the actual motor nerve enters into the muscle itself. Some people call that the neuromuscular junction. It's not my understanding of it. That would actually be the motor entry point. Then the nerve would then branch off and go into proximal neuromuscular junctions, and then still travel along into distal intramuscular junctions, neuromuscular junctions. So yeah, I mean, this is something, these points become Acupuncture points that have been treated for thousands and thousands of years, and very, very useful, as we know, to be able to treat these, and mixing these with acupuncture points to be able to
some of them are acupuncture points.
Yeah, many of them are acupuncture points, exactly. And also many of them are notable Acupuncture points. So by treating these in a system, we've seen that it can be able to relax the myofascial systems and change posture and such. Now, what's something that we haven't actually done, which in the seminars that we have, Michael and SMAC, when people ask questions about, do you apply electric stem to certain things? I do use electric stem on some, but only probably about 10%. This is where I refer my class to your program. Yeah.
And that's what I refer the neuromuscular section of mine to you, Matt. I swear to God, I tell all my practitioners, you want to really dive into this, go to the master, go to Matt, trust me.
Well, they both complement each other. They both complement each other very well.
Absolutely. Hey, if I can add some to that, when we were dissecting and I was doing that when we were working together, man, I have a picture of it, of the dissection of that neuromuscular junction that you were able to dissect right down to that junction. So we were able to do that with what? Scalpels, our hands, and our
Hmm.
eyes. So going back
Knowledge.
again,
Yeah,
knowledge, yes,
knowledge.
Hmm.
knowledge. And I don't think that it would behoove, I think it would behoove us to not think that maybe our ancestors had some of that
Sure.
understanding as well.
Yes.
And that they were doing dissecting, they definitely saw those wonderful nerves activating the
Yes.
muscles and put some of this together, and it might have got lost in translation a little bit. But man, Matt, you impressed me so much when you went right down and you nailed it, man. I mean, that was beautiful. It was really incredible.
Oh,
Yeah,
buddy,
it
I
seems
got
like
I
that's
got
a
lucky. Thank you for that. I appreciate it.
Lucky,
seems
I
like that's
doubt
a
that.
common misconception about dissection. I mean, the weights of the organs are in the classics.
Yep.
Just so much. There's a lot of anatomical description in there, and how much information is lost too, and how much of the information didn't carry forward in books that maybe got lost along the way. So I think it's obvious that there was dissection going on and exploration of anatomy, and how well that how deep that understanding was. It's hard to say, but it seems like it's pretty solid.
Yeah, absolutely. So
Yeah.
when they were doing the dissections, like Watteau, my hero, can you see him over my
Yes.
shoulder here? My inspiration, my leader.
Yes.
If there was ever a person that I would like to be able to have met, it would have been Watteau, right?
I would have liked to have sat down with Watteau and Galen from the Roman Empire that were at the same time, 180 AD.
Yeah, that's
Galen
cool.
knew the afferent and efferent nerves. Watteau knew the spinal segments. Man, let's have tea or some maybe Italian wine with them.
Do you think they would have gotten along? I don't know. We'd have to.
Yeah, right. Two empires, right?
Yeah, funny. Funny. Yeah. Well, what you're saying, Michael, is when they were doing dissection centuries ago and they saw it, we call it nerves. They were calling it channels and collaterals, the main nerves and the tributaries that branch off from that and innervate the body. Yeah.
Absolutely. Absolutely.
Hey, so Michael, you wanna lead off with Watteau Jiaji points and why you love them so much?
Oof, gosh, these are, when we get to this section of neuropuncture, when I first came across this, I just dropped the microphone. I was like, are you kidding me? Like, this was just such a beautiful explanation of our back shoe points and how powerful they are. And in short, the Huatou Jiaji points created by Huatou, discovered by him, it's not a coincidence that they line up viscerally with the motor or the muscular visceral reflex that's in the spinal segment. So when you needle into the muscle, and there's also a cutaneous visceral reflex, you're affecting these inner motor neurons in the spinal cord, and you can absolutely affect visceral change, and that's been proven. And it is just amazing. And the only thing that we do a little differently is we now know through, again, the great anatomy and biomedicine we know now, that there's not just one segment per organ, right? They might have 3 or 4. And we can really maximize that effect on the visceral function by having those deeper understandings. But man, they are just, it's incredible what he did. Incredible.
Yeah, that's right. That's why I always joke. And when you see images of him, his forehead is so big because his brains are so large, right?
Yeah, right? Good point.
Way ahead of his time. Brian, is there anything that you want to add to the Watteau Jiaji points?
Well, they're just the reflex and that segmental relationship between. I think most acupuncturists know this, but maybe not all, because it's kind of spotty, the anatomy understanding that's taught at school. But it's the same through the sympathetic division of the nervous system, the same branch that goes out and innervates the liver, or innervates, depending on which segments you're at, innervates the various viscera to give sympathetic nervous system information to regulate those organs. At that same segmental relationship are the ones that send that posterior dorsal rami, the medial branch of it, into the Watteau, and then the lateral branches into the internal and external back shoe line. So, I mean, it's really a segmental relationship between those viscera, those organs, the muscles, and the skin of the back, and then in that coming up through the lamina for the Watteaus, and then the outer ones for the back shoe points. And then, of course, wrapping around that same pathway and then coming and innervating the front mu points. It's neurology. Yeah. I mean, it's like, you can understand it so much better when you can see that neurology, when you can open up Netter and look at those cross sections and see the relationship between those nerves and how they would sort of have an influence on those various points, front move, back shoe, Watto, Chachi points.
Yeah. I mean, yin yang therapy, the classical needle technique utilizes that. The Watto, I'm sorry, it was yin yang therapy was front mu and base shoe. So front mu point and the back shoe point. But then by adding the Watto Jiaji points, you can see, because it is the same nerve pathway, it'll just emphasize that needle technique. It's useful to see a cross section, I think, like in the thoracic spine, to be able to see how the dorsal primary rami goes up to the Watto Jiaji, goes to the inner bladder line, goes to the outer bladder line. Then the anterior rami of that spinal nerve goes to the sympathetic ganglion, which, as we were discussing, stimulates the organs, right?
Yeah.
So, and this has all been proven. Then that same nerve goes all the way around to the front mu point, right? So you can see if there's going to be pathology, it will be facilitated. Therefore, all of those points along that spinal segment can be very, very tender. If we could be able to take ourselves in a small little car and actually drive from the dorsal, the dorsal primary rami, you can actually make it to the anterior rami, say hello to sympathetic ganglion, make a U-turn, go all the way back that intercostal nerve and say hello to the front mu point.
Yeah,
absolutely. You know, and there's that's amazing. And there's also, you know, I mean, Ren 12, right, having such a great effect on digestion. If you're needling out properly, I believe you're on actually splitting both dermatomes of 7 and 8. So you're getting liver, spleen, gallbladder, stomach, you know, pancreas just by Ren 12. And I think that's why that front mu is such a great point for the middle jiao, right? And when you line that up with dermatones and our front mu points, it really does show those connections that were found, again, you know, 180 AD, which is just incredible.
Michael, I have a question for you. I'm sorry, Brian, go for it, buddy. Then I'll jump in.
At one point, I think there was some questions on this about needling Watto points and why I particularly like those back shoe points are great, but Watto points, being that they're so protected by the lamina, you know, even over the thoracic region, you can needle them as long as you understand and you can palpate correctly. And you know, maybe with the exception with somebody who has really severe scoliosis, and you might lose sight of those angles. But if somebody with normal spine and you have good palpation, they're very safe to needle because you can go perpendicular and it's protected by the lamina as long as you're at that 0.5 sun. You know, I know some people do angle. I don't know, Michael, how you do it. Some people angle
perpendicular.
Yeah, perpendicular is how we teach it too. Though I think you get a good result needling it medially too. But the point is that the points are very protected, and you don't have to be as afraid of depth. Like, again, assuming you have the palpation and you were taught properly how to needle it.
Yes.
Brian, go ahead and plug the YouTube video that we have of that.
Oh yeah, we have. So we did a dissection. And we cut out, it is in the thoracic region. What was it, about T7?
It was T7. We've done it 5 or 6 times, but the video that's on YouTube, I think, is at T8 or T7.
Yeah, so it's in that thoracic region, and we dissected a triangle from, like, if this is the spine, a triangle out, covering like a range of 3, like T7, T8, T9, something like that. And then cut the skin away, and then the subcutaneous tissue. And then the first, you know, the lower traps, first muscle layer, and piece by piece, so that you can fold, you know, like a book. You can fold the skin back, you can fold the subcutaneous tissue back, you can fold the first muscle layer, second muscle layer, all the way to the deep paraspinals, and eventually seeing the lamina. And then you can see where the needle goes, you know, putting the needle in and then folding those layers back and seeing the target tissue.
Awesome. Yeah, Sports Medicine Acupuncture YouTube. Sports Medicine Acupuncture YouTube, Watto Jiaji video.
It was a bit of work to do the dissection.
Hey, remember, guys, when we were working together, Brian, I did the upper back like that, and we pulled the skin,
that's right,
the trap, the rhomboid, and then the paraspinals, and we put the needle, and it was like a I think we used a 40 or 50, you know, length needle. And we're just tapping, and there was room, so you can really show that depending on the patient. But that was so excellent. I love that
dissection. You know, I think our acupuncture field would take off if we had more dissection as part of the standard training. I know it's expensive, and that's really where the trick comes in. But you know,
that's where we're going, right, gentlemen?
Yes,
that's what we're trying to be able to do in both of our programs, is to educate the acupuncture field. With the cadaver dissections that we do in your program, the Neuropuncture, Michael, and our program, Sports Medicine Acupuncture. So this is great. And also other ones that we have.
Matt, I did have something that I thought you might want to add something to, and that is, and I know we don't have a ton of time left, but I don't think it'll take long. this idea with the Watto-Jiaji points and the affecting the muscle, therefore affecting the neurology, affecting the skin, but also the facet joints. I know that's a big part of the sports medicine acupuncture program in terms of the first module. If you wanted to add anything to that.
The location of it, and then different needle techniques at different target tissue. Okay. So if we're trying to
I'm also thinking about the movement of the facets, though, for fixations, vertebral fixations.
So you're wanting me to talk about vertebral fixations and needling the facet? Is that what you're saying?
No, not necessarily needling the facet, but vertebral fixations, movement of the facets, and how that relates to the neurological aspect too.
I'm not following you. I'm sure you're trying to dig something out of me from a conversation that we had. Sorry for being so dumb. So why don't you take it over and I'll add lib in? How's that? You know what you're talking about, and I don't.
In sports medicine acupuncture, we also look at the movement of the vertebral facets. It's in the first module. And we assess when the facets, when the joints are moving, when the spinal joints are moving or not moving, and how that, we have a whole protocol. I don't know if we have time to go into the protocol now, but that can relate when we're working in vertebral fixations of the neck. It can relate to injuries in the arm, low back. It can relate to injuries of the lower extremities. But a lot of times practitioners are also working with visceral problems, and they're doing various mobilizations in combination with Watto needling, with the Watto-Jiaji point needling, in combination with distal points, in combination with the whole thing. They're also going in and doing Tui-Nam mobilization to return mobility to those facets, which has a really big impact on digestive problems and really a lot of different visceral problems.
Yeah, I would say that's probably one of the biggest successes that we're having with that. Thank you for dumbing that down. Now I can be showing you.
I didn't ask it really well, I guess.
Now that I understand it, I'll say we do very similar work in neuropuncture as well. I've been taught traditional Chinese bone setting, and I teach that to my certified members, and that's exactly a great combination with Watto-Jiaji for visceral or peripheral, injuries due to those nerves. Absolutely, yeah. That's a great combo.
Fixated vertebrae, sublux vertebrae are obstructions in the channel, particularly the dumai, right? And so when you got obstructions in that dumai, it's going to offset the rest of the channels. Absolutely. Nice. So getting that vertebrae back into place, however you do it, forceful manipulation or mobilizations, movement therapy, all that is going to be is important. I mean, that's how the Chinese do it, right? So they would go from acupuncture to Tai Chi, Qigong exercises, their physical therapy.
Yep.
Yeah. Hey, you guys, we're already at 10:28.
Awesome.
Anything else that you want to say real quick before we give our thanks again and say goodbye?
I would just say that if our practitioners and our listeners open their hearts and their minds to what we're saying and do a little investigation and check us out, they're going to really have a deeper understanding, learn a language to communicate, and really get, I think, quite, just amazing clinical outcomes. And that is just, that's the bottom line. And we started with neurophysiology of acupuncture, and everything we just said and the discussion we had just illuminate all that, even bring it in historical relevance. I think that's just cements it back in and galvanizes it.
Yeah, absolutely. Yeah, I second the motion with that. For those people that are interested in what we were discussing and really excites you, yeah, please check out both programs and just see which one's the best fit, or both of them. Absolutely. Because Michael's a great guy, as you can see. He's super knowledgeable. He's a hell of a practitioner, and his protocols work. So that's something that you want. I mean, you need to be able to have that in your main focus of practice, and also different things you put in your back pocket. So when you're actually practicing yourself, you remember what Michael taught you, and that can get you out of a lot of problems. Yeah, both
Vice
of our
versa
programs are very treatment oriented, assessment and treatment oriented.
Absolutely.
So I think we have to do our little goodbyes now because it's 10:29. So I'm Matt Callison. I'm the president of the Sports Medicine Acupuncture Certification Program. My colleague and dear friend, Brian Lau. Go ahead, Brian.
Okay, I'm a faculty of sports medicine acupuncture certification and practitioner in Florida, along with Michael, though we're in different cities.
And thank you very much, Michael Corradino. I really appreciate you coming, pal. Yeah, it was really, really nice. We want to thank the American Acupuncture Council again for having us. Next week, stay tuned for Virginia Doran. She's going to be with us in the American Acupuncture Council, so that'll be something to check out. Again, you guys, thank you very much. It was a lot of fun.
Yeah, it's fun.
Thank you. You guys are awesome. I appreciate it. Very honorable.
All right, take care. Bye-bye.
Thanks, guys.